Okay, picture this. You're in the ER. A trauma patient comes in. They're hypotensive, and you can't get any peripheral IV access. The team needs to place a central line, and they need it now. The target? The femoral vein.
The clock is absolutely ticking. Every single second counts. And in a moment like this, there is zero room for error. You have to be precise, you have to be confident, and man, you have to be fast. You need a mental map of the anatomy that you can rely on, one that never, ever fails. Salam, and welcome to A Little Push, your home for 5-minute medical mnemonics.
So how do you pull that off? In that high-stakes, high-pressure situation, how do you find your target, that vein, while making sure you avoid the really important artery and nerves sitting right next to it? Well, there's a simple and honestly pretty elegant tool for that.
The answer is a mnemonic that's as simple as it is powerful. NAVEL. I want you to think of this as your anatomical GPS for the groin, specifically for what's called the femoral triangle. This thing is an absolute game changer for clinical practice and for crushing your exams. Yep, just these 5 letters. When you arrange them from lateral to medial, so from the outside of the body moving in towards the middle, they give you the key to mastering the anatomy of this whole region. So let's break it down, letter by letter.
First up, we've got N, and that stands for the femoral nerve. Just remember, this is the most lateral structure. It's way out on the side, farthest from the midline.
Okay, moving one step medial, we hit A for the femoral artery. Now this one is clinically huge. Why? Because it's the one thing in this group you can actually feel. That strong pulse is your #1 landmark.
Right next door is V for the femoral vein, and that's our target for central line access. So the key takeaway here is the vein is just medial to the artery. You know, a classic med school trick to remember this is the phrase venous close to penis.
Then we have E for empty space. This represents something called the femoral canal. Now I know it might just sound like, well, empty space, but trust me, this spot is critically important, and we're going to come back to why in just a minute.
And finally, L is for lymphatics, which includes the deep inguinal lymph nodes. These are the most medial structures in our lineup. So there it is. From lateral to medial, it's nerve, artery, vein, empty space, lymphatics. NAVEL. Simple, right?
Okay, so you know the order. That's great. But knowing it is one thing. Applying it is what really matters. And this is where the mnemonic goes from a neat trick to an actual lifesaver. Let's dive into 3 super high-yield clinical pearls you absolutely have to know.
Pearl number 1, femoral vein access. This is the most direct use of NAVEL. Like we said, you can't feel the vein, but you can definitely feel that strong arterial pulse. So it's a 2-step process. Step 1, find the pulse. Step 2, your target, the vein, is just medial to it. And hey, don't just take my word for it. The textbook Surgical Recall puts it as clearly as possible. Place needle medial to the femoral pulse. It really is that straightforward. Pearl number 2 is a classic exam trap, the femoral sheath. You see, there's this sleeve of fascia that wraps around most of these structures. It encloses the artery, the vein, and the empty space with its lymphatics. So which one is the odd one out? It's the femoral nerve. The N in NAVEL sits outside the sheath. They love asking about that, so remember it. And that brings us to our 3rd clinical pearl. Remember that E for empty space? I told you it was important. Well, this isn't just dead space, it's the femoral canal. And it's the exact spot where a femoral hernia can push through from the abdomen.
And get this, a whopping 85% of patients who get a femoral hernia are female. And because that space is so small and tight, these hernias have a super high risk of getting trapped or incarcerated and losing their blood supply, which is called strangulation. That makes them a true surgical emergency.
All right, you've got the map, you know the clinical applications. Let's lock it all in with a quick, rapid-fire review. You ready? Let's see what you remember.
First question. To access the femoral vein, where do you place the needle in relation to the femoral artery pulse? The answer is medial to the pulse. Exactly. Nice job.
Question number 2. Which structure in our NAVEL mnemonic is not contained inside the femoral sheath?
And the answer is the femoral nerve, our N. That's the odd one out. You got it.
Okay, last one. That empty space in NAVEL represents the femoral canal. What major clinical condition happens right at this spot?
That's right, a femoral hernia. See? You've totally got this.
So let's just quickly recap the big takeaways. From lateral to medial, it's nerve, artery, vein,
empty space, lymphatics. For vein access, you're going to go medial to the pulse. The nerve is the odd one out, sitting outside the femoral sheath. And that empty space is the weak spot where femoral hernias happen.
This simple mnemonic is such a powerful tool because it connects basic anatomy directly to life-saving procedures and some really critical diagnoses. You've got this. Keep learning, keep pushing, and make every single moment count. Until next time, salam.